I think that the main thing that when we think about teleneurology, we think about its potential to improve access to care. And so with that, the potential to maybe serve communities that have been historically underserved, and we see healthcare disparities. So I think that that is sort of the goal of it. But I think the question also, anytime you're changing sort of the care pattern, is also, well, what sort of new disparities might emerge? And, it's not necessarily going to be a panacea for all groups of patients. And so we need to understand who maybe we are helping to reach with that type of care delivery method, but who is not engaging with that method. So I think that's what's really important. And then, as you mentioned with the pandemic, obviously, the whole landscape of doing telehealth visits has changed dramatically, and so understanding sort of what telehealth utilization looked like before the pandemic and then what it's looking like now, which I think there's kind of different stages of that too. We had that early phase where it was almost mandated for everyone, and so it's very possible that in our clinics, most of our patients have now done a telehealth visit, but really over more of a longitudinal course, understanding how patients are continuing to engage in their care, because we want to obviously be able to use telehealth as a tool to help with disparities, but we need to be cognizant of any emerging ones that can happen with like a digital technology.
Yeah.